Okay, this is a new tutorial today. I just want to show you how to enter a new patient, and then this will be followed by how to enter new data on a previous uploaded patient. So the first step would be to create a file for a new patient. So here you go on the left, you see there's a green cross with new patient, so you can click on that, and the program will of course create beginning of a new patient. So you have to enter a name of patient. So let's say that I will enter demo, click on OK, and then this what we call the list of patient file. So you can see that you have three different types of patient starting by demo. So we need to add a new one. So you have to click on this green cross again, and then of course here we go with the creation of what I call the patient's file. So we have to enter the first name on the right. So we can say ONDB. You can enter the file number. So any type of file number will be accepted. Any type of presentation according to your institution. Then you have the maiden name, the patient number regarding to NHS. This is not mandatory. You can see we have two boxes here. We have one box which goes to gender, which is male. And date of birth is of course mandatory. Otherwise, the system cannot calculate the age of patient. And that's important for, of course, the database. So let's enter date of birth. So let's say, for example, 21/11/1956, for example. I don't know, 1980. So we have automatically age appears close to 40-year-old. On the right, you can import pictures and document, but I don't want to demonstrate that today. Now you have to create what I call the pathology file. Here you can see at the bottom of the screen, we have this first part, and then there's a second part for the geometry. But first you need to create the pathology file. Now let's go to create a pathology file. So I will click on the green cross again. We go add surgery file. So you have to select what type of surgery you have done. So let's say, for example, you have operated this patient for otosclerosis. So you're going to click on otosclerosis. You have a list of surgery which have already been uploaded in the program, but of course, as I will demonstrate in a different tutorial, you can add new type of pathology, new type of surgery. But let's say otosclerosis first. Now you have to say primary or revision, so that was a primary. And I've operated the left ear. So that's it. And now the system is creating this file, which is called the surgery file. So it's related to the surgery itself. So what I'm doing every time I have a patient and I'm operating a patient, just immediately after surgery, I do this. I enter the pathology file, create the surgery file. That's important. Otherwise, if you wait too long, then you lose exactly sometimes some information. If you look to this page, on the left, you can recognize the different tabs, same as the one you saw in the tutorial demonstrating how to use the results section of the program. So you have the stage, and at the moment, of course, stage is already selected as a primary. Then you have clinical with all items and subgroup, and you have to enter the fields here on the right. You can see that you have two types of signals here. You have the cross, which means that this is a multiple choice item. So it means that you can enter several sub-items, for example, like tympanic membrane, but also you have a red dot, which means this is a mandatory field, which means that if you do not enter any information for those two, tympanic membrane and external auditory canal, then in that case you cannot save the file. To save the file, you have to click on the green cross here. So the system is made like this. You can change, of course, these 2 points. You can remove or add any cross items, or you can remove or add any mandatory fields in a specific area of the program, which is again ONDB preferences and also the control panel sections, but I demonstrate that later. So we have the clinical, we have the surgery tab, we have the osteoplasty tab. Every of them, you saw them in the statistics and results section. So let's go for clinical, and you have to enter a few things. So let's say, for example, that was a far advanced otosclerosis. So you have a list here. I will find far advanced otosclerosis, which is right here. So I click to far advanced otosclerosis and validate. So then you have selected this thing. Now you can say hearing loss, which was bilateral and progressive. It's not mandatory because you don't have the red cross, but let's say you want to say that. The tympanic membrane is mandatory, so you have to say that the tympanic membrane was normal, and the external or D3 canal, let's say that you have some exostosis, so you can put some exostosis here. There we go. So now let's go to surgery. So you see it's pretty fast. The surgeon, that would be, for example, myself. So let's go. But you can enter, for example, a new surgeon. You can see here on the list you have for any items you have this point other. Means that if you click on that, you can enter any new name, item, anything you want, and then it goes directly into the program forever. I demonstrate that later on. Type of otosclerosis. Let's say that was an obliterative case. So I validate now. There was simultaneous malus ankylosis in this case. It was a pretty difficult case. So let's say I will enter simultaneous malus ankylosis. That's it here. You again have always other. So if you want to enter a new field, you click on that. Malus ankylosis. That's it. But you have another thing. So you want to enter other field. So let's go remove malus ankylosis by clicking on it. Then go to other, and then you type the name of the new pathology you found, which is not listed in a preloaded list. And then it goes there, and then you can also add malus ankylosis, because as you can see, you have a cross here, which means that it's a multiple choice item. Now, state-based surgical technique. This is a mandatory field, so I want to explain the surgical technique. But again, you have a preloaded list of surgical technique, and you can create a new name if you use a different technique which is not already listed here. So I've used a stapedotomy with interposition here, laser stapedotomy, and drilling stapedotomy, which means that as you know, I always use a combination of laser and drilling with a micro drill. There we go. Associated surgical technique, yes, of course, because I did the malus relocation. So I'm going to click on that, and I will add malus relocation technique. That's it. The laser setting, I don't want to enter that. Type of laser, that's the new laser I'm using now since many months, several months. So the CO2 luminous system, CO2 luminous system with the Otology. But again, if you click to other here, you can enter a new one. But there we go. And then interposition, material for interposition was, of course, as you know, vein graft, but you have other here if you want to add another one. And then the mucosa was normal. There we go. Saved. Then the osteoplasty area. You have to choose the type of prosthesis. I just want to demonstrate something. Let's say that you make a mistake and you click on a piston which is not right, because in that case you remember we have a malus ankylosis, so I remove the incus, relocate the malus, so of course I have to use a torque. But let's say we make a mistake. I'm going to click on this 0.4 Teflon piston. I click on validate, so it goes there. Now the position of the prosthesis, I'm going to put on malus to stapedotomy, and then prosthesis length. I like to enter this prosthesis length, so let's, for example, that's going to be 6.5 millimeter. And then cartilage interposition, no. All right, I'm happy with this. So I can save now this file, but by looking back to this file, if I go to osteoplasty, I can see that I made a mistake here. So I just want to change that. But the system has saved, you have saved the file, so you cannot change it. If you click on that, you see it doesn't open any window. So you have to click on this red button here, which is a padlock. So you have to click on that. By clicking on that, the program will ask your password first. This is the password you have decided to choose since the beginning of the installation of the system. Then you have to explain why you change this. I think it was important to add this point because, of course, in case of any audit in the future, if someone wants to study what you have done, they have to understand why you made this change, and it's good also for you good to remember why you made yourself this change. So click to OK. I have to explain. So I said wrong prosthesis. That's it, and then I click to OK, and then by clicking on that you can change. Now you see the list of the prosthesis appear again. So I will remove that, and then I will put the name of a new prosthesis which for example appear now. So it can be done really like this. Torque. There we go, and I click on that. And of course you will find this prosthesis forever in the future patient. Each time you're going to enter a new patient, since now you're going to find in the list. Now I click on save, and this is saved. Now we need to enter the audiometry. So you have to select, the audiometry is on the right. So you have to select this first. So you have to underline this line here, Tosca's primary, left side, and then click on the right. You have to click on the green cross. This will open up and create the first preoperative audiometric file. You can see that the date is there, August 28, 2020, that's today. But if you do it retrospectively, of course, you can change that, and you have to change that also for the date of the surgery, because of course the program will not accept the fact that you do a pre-op, which will be after the date of the surgery itself. So automatically the program will select this date, which is today, or you can click on that, and then you validate. And then there is the audiometric file of this patient for the left ear. And of course, this is the preoperative audiometric file. You can see here, preoperative. So you have the date here, you have the name, the first name, a few information about the patient himself. Here, you can see some boxes. Each box corresponds to frequency. And you can see that at the moment I can only enter 4 frequency, both for bone and air conduction, and for both sides. This is just because I decided since the beginning that I just want to study my results with the 4 frequency, 0.5, 1, 2, and 4 kilohertz. So at the moment you cannot enter anymore. But if you want to enter this, 125, 250, 3000, 8000, then you have to go to this area, which is the ONDB preferences. I will show you that later on. And then you can create and open new boxes for this frequency. But let's go with these 4 frequencies. So you can enter directly, of course, the number here. Let's say, for example, here. But you can also directly click on the screen and you create the audiogram. There is a possibility to export directly when you do the audiometric to enter the data directly on the database, but I always prefer to do it myself after the audiometry has been done. So let's go now for the left. There we go. And now we have to enter the air conduction. So I click on air conduction. Interestingly, if there is some security for the program, so if you try to click over the bone conduction level, then you have the program saying that air conduction level must always be superior or equal to PC level. So that's the security. So then you have to click and create the audiometry. There we go. That is for a speech discrimination. I don't want to use it now. So I'm going to save now this file. It's clear that if you forgot to enter 1 frequency, you cannot save, of course, the file. Same thing. That's it. And now you have created your patient file, preoperative audiometry related to the surgery. So you have all the information you need. just to show you something, if you go to, on the left, if you go to data modification, if you click on that, the program will enter all the modification you have done separately, and then you will be able to see your last one with the ONDB patient, which probably should be at the end of the list. So I don't want to lose my time with this, but it's at the end of the list. You will find the modification of the patient ONDB demo. Okay, that's again for the audit, and now you want to enter a post-op. So let's say, of course, this should be performed for post-operative after 3 months or 6 months, but just for a demo, let's say I'm going to click on that, and then you want to create the post-operative audiometric file for this patient who has been operated August the 28th. Let's say that we are November the 20th, so I'm going to click on that, click on green. This will add the audiometric. This is the post-op. So I will enter, for example, November the 20th, 2020. There we go. And now you see there's a slight difference. This is the post-operative audiometric file, so you still have patient information and the date of today. And the post-op, this is not pre-op, it's post-op now automatically. And you see you have the same 4 boxes. And here, underneath the audiometric, now you have a new window which is appearing because you have to enter also not only audiometric information but also clinical information. So let's say the right one was not operated, so it's pretty the same. This and this. So we have the same type of right ear, but the left ear was good, like this. For example, that's a good result. Now you have to enter the list of clinical items. First one is complication, and all these things you're going to find them on the statistics and results section when you click to post-operative. So complication, and again you have a preloaded list of possible complication. So of course you have known, you have everything, sensorineural hearing loss, fluctuating hearing loss, anything you want. You also have something like tympanic membrane lateralization or perforation, and other all the time. So click to known. There was no complication. Now osteoplasty, there is an extrusion here, so I click to extrusion, and tympanic membrane, there is now a perforation because of the extrusion. There we go. That's it. And now you have the pre-op and post-op, and of course the system is going to use all this information to make the calculation. So you'll find this new patient in your list, and this will be into the statistic part. So I think that was interesting to show you this, so you can see it's a very easy way to enter a new patient, and specifically also for the follow-up. There's another way to enter the follow-up. For example, if you see the patient after 6 months later, and let's say that's exactly the same audiometric file as audiometric data post-op as the one you had at 3 months. You have to check that, of course, but there's a way to duplicate it. So you can do this. You select this one, and then there's a box here, duplicate audio file. This will duplicate the file that the audiometric file you made in November. So you see caution, you will duplicate audiometric file. Yes. So you have to enter the date now. So let's say that was February the 3rd, 2020. 21. There we go. And now you have exactly the same. And if you want to make some modification, you can, because in fact, let's say it was nearly the same, so you don't want to click to re-click all the boxes, only, for example, the right one. If you have a dead ear, you click to dead ear, which is of course bad, but let's say that you can have that kind of things. So if you click to dead ear, then in that case, it goes to 0 or to 100 directly. All right, I think it was a nice demo. The next one will be to demonstrate the follow-up and also how to change everything in the control panel section and ONDB preferences. So thank you very much for watching again, and see you soon.